Bismillahirrahmanirrahim. Quote for today is keep your face to the sunshine and you cannot see a shadow. Today the topic of my presentation is hospital waste management and I'm presenting it under the supervision of my professor Dr. Saira Afzal. Learning outlines of the presentation are healthcare wastes, WHO facts, sources of hospital waste, persons at risk, management, medical waste management in Pakistan, recent updates and MCQs at the end. At the end of this presentation, participants will be able to describe the hospital waste management process and steps how to improve overall waste management for the betterment of the world and society. Now, what is a hospital waste? Hospital waste is any waste which is generated in the diagnosis, treatment, or immunization of human beings or animals or in research in a hospital. This is also called as biomedical waste. Hospital waste management means the management of waste produced by the hospital using such techniques that will help to check the spread of diseases too. This shows the key facts that are given in the WHO site of the total amount of waste generated by the healthcare activities. About 85% is general non-hazardous waste. The remaining 15% is considered hazardous material that may be infectious, toxic, or radioactive. Every year, an estimated of 16 billion injections are administered worldwide, but not all of the needles and syringes are properly disposed of afterwards. Open burning and incineration of healthcare wastes can, under some circumstances, results in the emission of dioxins, furans, and particulate matters. Measures to ensure the safe, environmentally sound management of healthcare waste can prevent adverse health and environmental impact from such waste that are including the unintended release of chemicals or biological hazards that include drug-resistant microorganisms into the environment, thus protecting the health of patients, health workers, and general public. This slide shows the data on the medical waste generation rate, environmental performance index of controlled solid waste management, of human development index, life expectancy, and health expenditures per capita of GDP. This is shown for the region of Asia in India, China, Iran, Pakistan. In Pakistan, it is shown that medical waste generation is at the rate of 0.3 kg per bed per day. This map is also showing the medical waste generation per kg per bed per day, as I've shown in the earlier slide in the form of table. This is given in the form of map. According to WHO, there are two types of hospital wastes, hazardous and non-hazardous. Non-hazardous general waste comparable to domestic waste is approximately 75 to 90% of healthcare waste in a health facility. Potentially hazardous waste or waste that is associated with some health risk or 10 to 25% of healthcare waste in a health facility. This shows types of medical wastes in person and the composition of medical wastes in person. It shows that 67% of the wastes is general waste. That one in orange color shows 27% is infectious waste and sharp waste is only 4%. Where in the form of table and graph, it shows the plastics are 36, syringes are at the level of 4, and glass is at 4, while general waste is still the highest, 56. Sources of hospital waste. Main sources are hospitals, clinics, laboratories, research activities, nursing homes, acupuncturists, paramedic and ambulance services, animal research, blood banks, mortuaries, and autopsy centers. Other sources are physician's office, dental clinics, psychiatric hospitals, cosmetic piercing and tattooing, institutions for disabled persons, funeral services, and home health care. Next is health risks from poor hospital waste management. Types of hazards that can be faced are: first is the exposure to hazardous healthcare waste can result in a disease or injury. The hazardous nature of the healthcare waste may be due to one or more of the following characteristics. It can contain infectious agents. It is genotoxic. It contains toxic or hazardous chemicals or pharmaceuticals. It is radioactive. It contains sharps. Now, persons at the risk. The main groups at risk are the following: medical doctors, nurses, healthcare facilities, hospital maintenance personnel, patients in healthcare establishment or receiving home care, visitors to healthcare establishments, workers in support service allied to healthcare establishments such as laundries, waste handling, and transportations, workers in waste disposal facilities such as landfills or incinerators, including scavengers. Now, routes and transmissions of diseases. There are multiple routes, however, the main routes are described in the form of graphs. Through a puncture, abrasion, or cut in the skin, through the mucous membranes, by inhalation, by ingestion, human immunodeficiency virus, tetanus, and hepatitis virus C and B. Hazards from chemicals and pharmaceutical waste. Intoxication can result from absorption of a chemical or pharmaceutical through the skin or the mucous membrane or from the inhalation or ingestion. Disinfectants, obsolete pesticides, chemical residues. The cytotoxicity of many anti-neoplastic drugs is cell cycle specific, targeted on specific intracellular processes such as DNA synthesis and health impact on healthcare waste. 23 mitosis. This picture shows the management status and practice of medical waste in different countries. Figure 8 is showing the risk of injury in workers that are involved in medical waste disposal in the studied countries. B shows the medical waste management knowledge and awareness among the workers. C shows the workers trained in service for medical waste management, while the D shows the quantity of medical waste segregates at the sources. And it's at the top for Brazil, as in shown in the figure A. This is the hospital waste management hierarchy. What things are least preferred and what is most preferred. The thing that is least preferred is disposal, that is landfills. The thing that is most preferred is air source segregation and reuse. Waste minimization and sustainable use, multi-use of products, reuse carry bags, packaging jars, bottles, boxes, and wrapping, etc. This is the most preferred. After that is recycling, then compositing, and then waste to energy. However, at the end is disposal. Now, management of healthcare waste. There are made national policies, strategies, plans, and guidelines and SOPs. Legislation and rules for waste management are made. Political commitment is done, committed manpower is needed. Good management is the basic for all these things. However, proper budgetary allocation and effective waste management needs. All these are the factors that are required for the good management of healthcare waste. Now, WHO hospital waste management cycle. This shows that waste minimization can lead to waste identification, then waste segregation, then waste handling, that leads to waste treatment and disposal, that helps in record keeping, and record keeping helps in the training of the personnel. Training leads to supervision and monitoring, and that in turn can lead to waste minimization. Steps in the management of hospital waste. First is training and awareness, second generation, third segregation, separation, fourth collection, transportation, storage, treatment, and final disposal. Waste immunization. Waste minimization is the process of elimination that involves reducing the amount of waste produced in society and helps to eliminate the generation of harmful and persistent waste. This shows waste minimization techniques, source reduction and recovery or reuse or recycling. It may be on-site or off-site. For source reduction, product change, process change, and good practices are required. While for recovery or reuse, recovery and return to original process and recovery and raw material for another process. And processing for resourcing, recovery processing to create a useful byproduct. Waste identification. The appropriate way of hospital waste identification is by sorting the waste according to different color codes. Color code is easy for identification and therapy, easy for safe handling, transportation, and treatment. And the color code varies from country to country. This slide shows WHO recommended color codes that highly infectious are in color red, infectious, pathological, or anatomical are in the yellow box, sharp are the yellow colored box, chemicals, pharmaceuticals in the brown box, radioactive in the silver, and general waste in the black. This shows a black bin and white container. Black bin contains non-infectious general waste like food waste, mineral water bottles, paper waste, etc. Well, white container, all infected sharp wastes are included in that. So that may include needles, syringes with fixed needles, needles with a top cutler or burner, scalpels, blades, and contaminated sharp objects. Red bin, all infected plastics and rubber wastes are included in the red bin. All infected plastic that is infective in the form of drips and rubber gloves that are used at the time of examination, all are included in the red bin. In the yellow bin, human or animal anatomical and solid wastes are included in this, like tissues, organs, body parts, any dressing part, plastic casts or cotton swabs are included in this. Color code practices in a Mayo hospital. This is seen as red, yellow, green, and brown boxes. Now, waste segregation. Waste segregation means dividing or separating waste at earliest opportunity at point of origin, not allowing hazardous waste to mix up with the non-hazardous waste. If waste is properly segregated, then only small amount is needed for disposal. Ultimately, the related cost, manpower, and health risk is lowered. Waste handling means the links between packing, storage, and transportation of medical waste from every area of institution by the designated individuals. In the waste handling, it evaluates your waste, stores the waste, labels the waste, transport and dispose your waste properly, plan for emergencies, train personals, and then keep recording. All these are the steps in handling waste. Now, outfit of waste handlers. This is shown as personal protective equipments. All these were used in the excessive way in the COVID days. First is an apron, then mask, cap, goggles, heavy duty gloves. Face shield is a must for infectious diseases, and gum boots. Waste collection is the collection and transport of waste to the place of treatment or discharge by the municipal services or similar institutions or by the public or private corporations, special, sorry, specialized enterprises or general government. This slide is shown as the waste collection. First step is primary collection and storage, secondary collection and transportation, then transfer stations and transportation, after that composite and then engineered and secured landfill. In the transportation, first is in-house transportation, second means transportation of waste from the site of origin or collection to temporary storage area within the institution. Last is the waste should be transported by the designated trolley through the designated route according to time schedule given by the institutional authority. Temporary in-house storage is the store will be a room or a building within the healthcare facility, depending on the quantity and quality of waste production and frequency of waste collection. Normally, the waste should not be stored more than 24 hours. In the record keeping, it's the first is to assess the recurrent expenditure and assess the quality or quantity of the generated waste. Treatment and final disposal of the hospital waste is incineration, chemical disinfection, and render inert. In Pakistan, local and municipal governments are responsible for collecting waste throughout most of the Pakistan's major cities. About 60 to 70% of the solid waste in the cities is collected. Other major cities plan to build proper landfill sites. In many areas, solid waste is simply dumped outside the city limits. At Waste Management Company. AT Waste Management is an incineration facility which is accredited with Punjab Environmental Protection Department. This slide shows the Lahore Waste Management Company. Now coming towards the recent updates. An article recently published is Current Practices of Waste Management in Teaching Hospitals and Presence of Incinerators in Densely Populated Areas. This article shows that hospital waste management practices are the core need to run a proper healthcare facility. This study encompasses the hospital waste management practices in teaching hospitals of Peshawar, Pakistan, and examine the enforcement of Pakistan hospital waste management rules that were given in 2005. In surveyed hospitals, only 9 hospitals were found with the incinerator facility, while rest of the hospitals practiced upon dumping. WHO issued documents for improving hospital waste management practices but triggered no change in Pakistan. To improve the situation, insights in this context is needed for enforcement of rules. Now, solid waste management in Pakistan. It shows that the management situation in Pakistan is a matter of grave concern as more than 5 million people to die each year due to waste-related diseases. In Pakistan, roughly 20 million tons of solid waste is generated annually, with the annual growth rate of about 2.4%. Karachi, the largest city in the country, generates more than 9,000 tons of municipal waste daily. All major cities, be in Islamabad, Lahore, or Peshawar, are facing enormous challenges in tackling the problem of urban waste. The root factors for the worsening garbage problem in Pakistan are the lack of urban planning, outdated infrastructure, lack of public awareness, and endemic corruption. Now, current activities and projects according to United Nations Environmental Programme, there are 6 current activities and plans taking place towards an efficient waste management system. These current activities are as follows. First is the Solid Waste Management Guidelines prepared with the support of Japan International Corporation Agency, converting waste agricultural biomass into energy material source. North and Urban Services Corporation Limited, the Urban Unit, Urban Sector Policy and Management Units, Lahore Composite Limited, only dealing with the organic waste with the Corporation of City District Government Lahore, Pakistan. And different NGOs are involved at the small scale for solid waste collection and recycling. Now coming towards the MCQ session. First MCQ is an inspection team decided to see the amount of waste generated in one of the hospitals of Sindh province. After analysis, the team reported that maximum reduction in overall waste generation on an individual level can be done by which of the following integrated waste management. Option A is source usage, option B is source reduction, option B recycling, option D is disposal, and option E is burning. Option B is the yes, source reduction is the main thing. Second MCQ is the yearly report on the hospital waste management of a country XYZ shows that 75% of the medical institutes are using appropriate waste disposal techniques. These institutes are considering the standard procedures of waste treatment. According to scenario, which of the following would be the least practical biomedical waste management process to adopt? Option is control of waste generation. Option B, storage and collection. Option C, proper disposal. Option D, incineration of waste. And option D, stop waste generation.
E.
B. Option E is the right one because this is the least practical method. Because in practice, we cannot help in the stopping the waste generation. In a hospital XYZ, most of the biomedical waste is disposed by treatment at different temperatures and by using chemical agents. The waste management team lists the method used at the hospitals, including all except. Option A is incineration, option B is chemical disinfection, option C autoclaving, option D washing, and option E sieving.
A.
D. Option E is the right one. Sieving is the process that is not used in the hospital waste management. Fourth MCQ is as a part of the awareness campaign in a medical university XYZ, the students are instructed to perform a drill where they must correctly segregate the provided waste items. At the first table, students are provided with the multiple used syringes. Where would they put the syringe considering the standard color coding? Option A is pharma pill. Option B sharp containers. Option C green pill. Option D yellow pill, and option E red pill.
B.
Yes, this is the right answer. Fifth MCQ is in a hospital XYZ, the workers are directed to perform a task where they must correctly segregate the provided waste item. Where would they put the cytotoxic vials considering the standard color coding? Option A is red pail, option B sharp containers, option C green pail, option D pharma pail, and option E yellow pail.
Red pail.
Yes, option A is the right one. Red pail is the answer for cytotoxic vials. Sixth MCQ is a 45 years old male XYZ applied for the job in the waste management department. After getting the job, he was asked about the vaccine status. According to WHO guidelines, which of the following vaccines should be given to workers who deal with the biomedical waste? Option A is tetanus and rabies. Option B, Hep B and tetanus. Option C, tetanus and rubella. Option D, rabies, and option E, HIV and HPS-AG.
B.
Yes, B is the right answer. HPS-AG and tetanus is given. Seventh MCQ is while segregation of the hospital waste, the workers found lots of cytotoxic and expired drugs. For their proper disposal, which of the following methods would be used so that minimum quantity of residual waste is left behind? Option A is dumping, option B autoclave, option C boiling, option D incineration, and option E chemical disinfection.
A.
Option C is the right one. In this case, incineration will be used because the residual quantity that is left behind will be minimum. While in dumping, there will be no quantity left. All that will be dumped. Eighth MCQ is what is the order of waste management hierarchy from most to least favored? Option A is prevention, recycle, reuse, disposal. Option B is prevention, reuse, disposal, recycle. Option C is prevention, disposal, recycle, and reuse. Option D, prevention, disposal, reuse, recycle. And option E is prevention, reuse, recycle, and disposal.
A.
Option E is the right one. Prevention, reuse, recycle, disposal is the most or least favorite. Ninth MCQ is according to the standard segregation rules of hospital waste, the color code of the pail for disposing of microbial laboratory culture waste with blood and pus samples. Option A is black, option B green, option C red, option D blue, and option E white.
C.
Yes, C is the right one. Red color code is used. Foley's catheter, 10th MCQ is Foley's catheter is used for urine correction of patients suffering from BPH and other infective conditions. The cover of Foley's catheter of HPS-AG positive patients is disposed of in a which colored bag? Option A yellow, option B red, option C blue, option D black, and option E white.
E.
Blue.
Black color will be used. This is the key of MCQs. These are references. This is the YouTube link. And thank you.